Okay guys, we're here to talk about tennis elbow. What is a tennis elbow, or what does it mean to be diagnosed with tennis elbow? So tennis elbow can be simplified to an irritation of a subset of muscles that sit on top of your elbow. So some fancy ones like the extensor carpi radialis longus, extensor carpi radialis brevis. These are some muscles that are outworked. They're overworked and they're causing some symptoms in your elbow. Fun fact. So it wasn't until the late 1800s that they coined the term tennis elbow. And it was at the time because so many people were playing tennis and they were hurting the top of their elbow. Traditionally, as they go through a backswing, that's when they are causing most of their symptoms. But you don't necessarily have to play tennis just to be diagnosed with tennis elbow. It's simply an irritation of the muscles. So it could be occupational related. You could be playing other sports and still have that problem. The big question is, how can we help? It's a great question for tennis elbow. The answer is simple, but it's not easy. So if you're only looking where the problem and the pain is, you're absolutely missing out on this one. We'll address your issues at hand and do some different tissue work, treatment strategies to help loosen that up and make it feel better, of course. I'm huge on trying to find your long-term resolution. So with those who have lateral epicondylgia or tennis elbow, I'm going to be looking at your shoulder strength. I'm going to be looking at your core strength. I'm going to be looking at your glute strength. I'm going to be looking all the way down into your heel, your toes, everywhere. Now, it's going to be specific based off of what sport you play, what occupation. So we're going to really have to kind of sit down and talk about what things are you doing a lot that's causing those muscles to overwork, okay? So I don't have necessarily a secret sauce, try this, try that, but I do have the concept that if you're only looking at just where the pain is, aka the elbow, you're probably missing out. For a lot of my recreational athletes and those who are serious in competitive sports, it's really important that we take you through a functional movement screen to assess how you're moving overall and to see if you're solely relying on that elbow to save you. Okay, that's about all the information I can give right now on tennis elbow. I hope that helps. Thanks, guys.